You can probably figure out why touching our face is a quick way to spread germs from our hands to the inside of our body and vice versa. And one of those ways is through your eyes. That's right, coronavirus can spread through the eyes. We sent Delmarva Life's Katie Zerilli to Chesapeake Eye Center to explore that aspect of the pandemic.
Lisa, COVID-19 and our eyes is something we might not think about, but it is something we should consider. And that's why we're here at Chesapeake Eye Center today with Dr. Catherine Smoot, who is a board-certified ophthalmologist. So tell us how COVID-19 affects our eyes.
Well, there have been demonstrated viral infections from the tear film itself, actually. I think 1 out of 25 patients in the United States tested positive in their tear film, and I believe a couple in China. We think the incidence of finding the COVID-19 virus in the tear film is somewhere from less than 1% to 3%. It brings to our mind that a lot of viruses can give you conjunctivitis, so I'm sure this one can present in the same way. And our Academy of Ophthalmology has suggested we take the appropriate precautions, as should your viewing audience. And by that we mean hand washing, which you're hearing repeatedly, and that is absolutely your #1 defense. Number 2 is don't be rubbing your eyes. A lot of people just rub their eyes out of habit. Please don't rub your eyes. If you do, immediately wash them again. Don't touch surfaces and then rub your eyes, because if that is a route of transmission or potentially through viral particles, you want to avoid that. Contact lens wearers, be a little careful in terms of the way you're manipulating. Wash your hands before, wash your hands after. And just because you have pink eye doesn't mean it's the COVID virus. The more common viruses are the adenoviruses, which is a whole different animal. They're all contagious, all require the same hygiene.
So if people are coming in here and maybe they're worried about their appointments, how do they know maybe they should cancel them? Like, are people getting worried about that?
Well, sure, and I think it is appropriate to have social distancing, social isolation, take it seriously. However, there are people that do need ongoing medical care, and I don't care if you're your primary care doctor or your ophthalmologist, there are steps you can take. If you are sick or ill, please call to cancel and reschedule your appointment so you're not exposing your healthcare providers or other patients, particularly in the age group that we see, which are more seniors. When you come in and you check in, make sure you're socially isolating yourself, appropriate distance. Request leaving your cell phone number at the desk upon check-in and wait in your car and wait to be called in. If you really are concerned or immunocompromised, your providers will work with you to reschedule appointments. If not, when you do come into your provider's office, we're taking precautions, hand washing aggressively, wiping down with Lysol. We've pulled all magazines and paper goods, anything that might, not think about transmitting viral particles. And we try to get you in and out in as quickly a fashion as possible, and that's true for all practitioners. I mean, let's face it, we also don't want to be exposed. So
absolutely, right.
We're taking the same precautions.
If you are a contact lens wearer, you did mention that, like if you start wearing glasses more, is that going to prevent the spread of this?
Actually, it's not that glasses prevent the spread, but glasses are another barrier between you and the virus. Right. So if you're a contact lens wearer, it's not a bad idea to maybe switch to your glasses or wear them more frequently. You may find in an ophthalmologist's office or your primary care office, maybe they're wearing masks. In our case, we might be putting a protective shield at that slit lamp because we're only about a foot from your face. If you have to cough or sneeze, sit back. Again, remind everybody, not all coughs, not all sneezes, not all respiratory infections are COVID. Yeah. The difference between this COVID is that it's highly infectious. We think that there might be 7 times as many people infected as we're testing. We don't know. And then when you get sick, you can get really sick and a high mortality rate. So to the credit of the providers in this area, they're doing a great job through PRMC and the task force that they've set up to keep all of us informed through regular updates, where we stand in the community, what we should be doing.
Well, thank you for providing some, information on something people might not think about, with this, and thank you for all the precautions you guys have taken here.
Well, I appreciate it. Thanks, and have a great day, and everybody stay safe, stay socially isolated, and be responsible.
Dr. Catherine Smoot, thank you so much. Back to you guys.
And as always, Dr. Smoot has found a way to make topics like this crystal clear.